estamos con el doctor Khurshid Ghani de la Universidad de Michigan, speaker del Congreso de este año en Guadalajara, para hacerle algunas preguntas. First, Dr. Ghani, thank you so much for being here with us in Guadalajara.
Thank you, Mario.
My first question would be, what's your impression so far of the meeting?
Well, I want to thank the leadership of SMU and you and all your colleagues for the great honor to be here. My impression is that urology in Mexico is very vibrant. Over 2,000 people here at this conference, which is a huge number of folks. The quality of the sessions with the plenary and the breadth and depth of your international speakers are pretty amazing. So I would say it's my first time at the SMU Congress. I hope not my last, but I would say congratulations. It's a great international conference.
Thank you. Yeah, I'm pretty sure it won't be your last time around. I'm sure about it. So I wanted to ask you about this music collaborative initiative you have. What is your role there? How it started, and what are your goals, like research goals, on this initiative?
Yeah, it's a very unique collaborative that's in the state of Michigan that is funded by an insurance company called Blue Cross Blue Shield of Michigan. The collaborative is called MUSIC, which stands for the Michigan Urological Surgery Improvement Collaborative, and it was set up in 2011, and the goals initially were to improve the quality of care for patients with prostate cancer.
Okay.
And the thing about care in the United States is it can be highly variable, and the costs of care are very high. So it was initially set up by some of my partners to look at prostate cancer outcomes and sort of harmonize outcomes, improve quality of care, reduce costs. Mm-hmm. I joined in 2014, and we expanded the focus into also kidney stones, kidney cancer, and now we have a BPH program. Nice. And what we do in the program is we collect data from all the centers. There's around 46 centers in the state of Michigan who are part of the collaborative. And then we analyze the data, and we look at outcomes, and we start to understand where there are problems in quality and what can we do to address them. So it's unlike, it's a quality improvement group, unlike pure research, which is just making findings. Our findings are developed into interventions that we then put into the practices with the goal to change the rates of those outcomes.
Okay, yeah, and particularly there is this project you've been talking about, like branches off from music, about the stents. Mm-hmm. And it's fascinating because we struggle a lot with encrusted stents, forgotten stents here in Mexico. So what would be your piece of advice with the evidence you have so far collected about not placing stents?
Yeah. When we started the journey in music, around 80% of patients were getting stented after urethrostomy. I think we are now approaching 60%.
All right.
So as a state. Mm-hmm. So with our education, with our initiatives, we're seeing a reduction in stenting. It takes some time, but teaching urologists what are the scenarios where you can comfortably leave a stent, making sure urologists know what are the pain medication management to get people through urethrostomy safely, letting patients, giving patients, one of the biggest things that we've done is giving patients education on what is a stent, what to expect from a stent. So all of those things have actually driven down some of the rates of post-operative visits to the emergency room in Michigan. So those are all things that have been done through the hard work of all the members and the team supporting music.
That's fantastic, great job, and congratulations. And just to close this interview, I noticed that many young fellows and med students have approached you in order to, probably get an observership or trying to get involved in research. Any message you want to deliver to these young, enthusiastic guys in Mexico?
Yeah, well, first of all, I'm always humbled, and it's a great honor when the next generation come to me. Look, I was that same person many years ago, looking to say, where could I go? How can I advance my career? My advice is, those are the things you have to do. You have to approach at these meetings the international professors if you have any desire to go and visit a different country and learn from different practices. So I would say, we welcome those interactions. I would say, dream big, and don't be limited in your ambition, in your aspirations. That hard work and resilience and grit will get everyone through. And I truly believe in ability. Show your ability, and you will shine through. So I hope many medical students in Mexico can become urologists, and I hope many of them serve the needs of the country of Mexico, which is where your primary focus is. But there's also the world is a global community now, and so we do support observerships at University of Michigan. So we do welcome people to come and see our center, what it's like a U.S. practice. It can be challenging to get into training, but there are research fellowships that many people do, and so I would just say, I think dream big, don't be put off, but happy to hear from anyone who's interested.
Thank you so much for your time, Dr. Ghani. Thank you.
Thank you.